Look at this beautiful book. Haven't gone into this for a while, and I apologize for that. Thank you guys for following me. This is Emmanuel, your Las Vegas emotion code practitioner, and just wanted to keep going along with this book. And so for those of you who have been following me, I'm going to actually order all the books, the channels, the YouTube videos in a row of all the episodes of page by page commentary. I've heard a couple people comment and say, can we just have it all in a row so it's all organized, we can listen to it back to back? And the answer is yes. So let's get right to it. We are on page 71 and we're going to go to page 76. I'm going to read along. Some people say I have a very nice voice, so I'm going to use the talents that I have and try to read as calmly and peaceful as you drive in your car. I'm picturing you driving your car, going to work, listening to this audio. So let's get started, and I'm going to add my input as a practitioner. I think I've worked with close to now maybe 1,700 people within about a year and a half, and so I've definitely gained more and more experience. So when I read this book, it means something different to me when I read it. So let's start off with Rochelle's lung cancer. So when Rochelle first came to me for treatment, she had a cancer the size of a baseball in her lung. She was going through chemotherapy when we met. I asked her body if there were trapped emotions in this malignant lung tissue, and the response was yes. The trapped emotions in Rochelle's tumor dated back many years to a time when she was a young woman. She was Filipino and had married an American sailor stationed in the Philippines. After they had a child together, Rochelle's husband was away at sea for 6 months or more at a time. She'd expected his frequent absences and had come to terms with the separation in her conscious mind, but raising a child by herself was difficult and lonely. Consciously, Rochelle believed that she was fine with his absence, but her body revealed that the emotions of resentment, frustration, and abandonment had become trapped inside of her during this period. So it's interesting. These are the three emotions that she experienced: resentment, frustration, and abandonment. So, no, Rochelle insisted. I never felt that way. I knew Danny would be gone and he was fine with me. I was okay on my own. And yet, after I'd run the magnet down her back, Rochelle sat up and shook her head. You know, it's the funniest thing, she said. I feel so much lighter, like a weight has been lifted from my chest. Since she had to drive 90 minutes each way. By the way, what's really interesting about this weight being lifted from the chest, one of the greatest things I've seen Dr. Bradley Nelson do is that show us the reality that this is not a placebo effect. I think that was one of the major things that I appreciate about this work, because when you first look at it, it kind of looks like when you're talking to someone and you're telling them what you're doing, that perhaps they might be, they have this kind of like hope, and that they're going like, okay, I'm going to like force my body to heal itself somehow, and then it might be some type of placebo effect. But then the more I worked with dogs or animals where the dog wasn't even in the room, or if I worked with a child, which obviously the child is not even there, is at school, then there is no placebo effect, because the placebo effect would mean that they would have to know that they're engaging in something mentally for it to be placebic. So it kind of cancels that out. But even beyond that, if you really, for those practitioners out there, if you really want to prove to someone that this is real, is I do two things. One is I want them to know what muscle testing is, so they know that their bodies are giving responses. I usually use this finger one right here, where I say, go ahead and state your name, and then they state their name, and then it's smooth. And if they say, well, my name is Emmanuel, so it's smooth. Then my name is Bob, and then all of a sudden it's a little bit of friction there. Or today is Wednesday, it's smooth, and today is Sunday, all of a sudden it's a little bit sticky. That's not going to be super obvious, because if they're pushing hard, they're not going to notice. But if it's light, then they'll notice. And so that's one thing I do to let them know that this is real. And I want them to be like, whoa, why does my body do that? And then I tell them, I say, this is what I'm going to be tapping into when I'm working with you. Now, the second thing I do, if they're in person, is let's say I find like anger or resentment or bitterness, all that stuff in the liver area. So I ask, where is this trapped emotion located? Sometimes it's trapped around the area that created it. Sometimes it's somewhere else. You can ask, is this on the top half of your body? Body says no, it's on the bottom half. Okay, it's on the left side, or is it on the right side? It's on the right side. Okay, so then he puts his hand. What he does is says, I want you to. He starts basically using one arm to muscle test the client, and the other hand to get slowly close to the body of the area that has the trapped emotion. That's basically kind of like bubbling on the surface of the skin. And so he puts his hand closer and closer and closer to that area where the body told him that's where it's going to be. And as soon as he touches it, boom, the arm goes down. So again, makes it more real for the client that's visiting you. Be like, why did my arm go weak all of a sudden? You didn't even touch me. You were close to touch me, but then all of a sudden my arm goes down. And then what you should feel as a practitioner is like a light wind of air on your hand. And it makes it even more real for you as a practitioner that this energy has this cooling wind effect on your hand. And so these are just some things that I've learned recently at a conference. And I thought, I'm just kind of using this as artillery to help that just in case someone's skeptical, that I can add to their belief is have them muscle test if they're present, have their arm go quickly down by default because of you touching their trapped emotion. Anyway, so since she had to drive 90 minutes each way to my clinic, I only saw Rochelle 3 times, but it was enough for me to release all the trapped emotions that showed up in the area of her tumor. About 5 weeks later, she showed up at my office ecstatic over the good news. Her doctors had taken a new x-ray, and the tumor was completely gone from her lung. Could the trapped emotions have been a significant contributing factor in the creation of this cancer? I believe that the answer is yes. Of course, I can't prove that the release of the trapped emotions eliminated the tumor, since Rochelle was also undergoing chemotherapy, but by removing the emotions that were lodged in her chest, we may have made the chemotherapy more effective. The removal may have given her body the edge needed to heal. I hope to live long enough to see a day when all patients will be treated with the best of all methods like this. Jean's painful ovary. One of the things about trapped emotions that surprised me the most is that their ability to cause physical pain. The very first experience that I had with this phenomenon was quite dramatic. My wife, Jean, suddenly began experiencing acute and severe pain in her left lower abdomen. Muscle testing showed that the pain was coming from her left ovary and that the cause was emotional. As rapidly as I could, I began to identify the emotion responsible. To my surprise, I ended up finding not one, but 6 different emotions. As you will learn later on, we release trapped emotions one at a time. Sometimes more than one trapped emotion will be found nested in the same area, such as in the case. So he uses the term nesting. With the exception of the last emotion, all of them had to do with tragic or upsetting events that had occurred in the lives of women that were close to Jean. I released each trapped emotion as it was identified. Amazingly, her pain level decreased instantly and noticeably with each trapped emotion that I released. After clearing 5 trapped emotions, her pain level was a fraction of what it had been only moments before. I've seen, like I said, I work with about 10 to 16 clients a day, and it's amazing. Sometimes I do find multiple trapped emotions, and I just tell them to take a deep breath, walk around 10 steps to kind of shake the energy off, and I ask them, where is your pain now? So it's very important to get the number, where it is right now, so that way you have some gauge to see if it's improved. And so her body indicated there was one more trapped emotion. Testing quickly revealed that an emotion of feeling worthless had been trapped when Jean was in kindergarten. The year was 1960. It was an election year, and the contest was between Richard M. Nixon and John F. Kennedy. Jean's teacher informed her that a boy and a girl from the school had been chosen to be interviewed by the local newspaper about the upcoming presidential election, and that she was one of those chosen. She was told that she would be asked some questions about the candidates, particularly who she would vote for if she could. She was excited, and the big days soon came. She was ushered into a room at the school that had been prepared for the interview. There were 2 chairs set up right in the front, one for each child. The interviewer began asking questions of the little boy first, while flashbulbs popped as his picture was taken. Although her picture was taken, for some reason, no questions were asked of Jean at all. She was ignored almost completely, with the exception of being told how to pose for the photo. Wow. Okay, so suddenly the interview was over. As she was ushered back to her classroom, she felt confused. Gradually began to dawn on her how unimportant she may be. Wow, okay, this is in kindergarten. She began to feel worthless, and she felt the emotions strongly enough it became trapped in her physical body. So emotions are energy, and the specific vibration of an emotion determines precisely which emotion it is. A trapped emotion is like a little ball of energy, which will always land and become lodged somewhere in the physical body. For some reason, this trapped emotion, worthless, lodged in Jean's left ovary, where it remained for 30 years. When we released that last trapped emotion, the remnants of her pain were instantaneously gone. She got up to the floor, and we looked at each other in mutual amazement at what just happened. Jean had never had a reoccurrence of pain in that area. I can't help but wonder what the consequences to her health may have been if we had not released those energies from her ovary. It could be like ovarian cancer. Who knows? My mother had pancreatic cancer. I'm pretty sure if I were to remove trapped emotions from the tissues of that area, who knows? Maybe she would still be here right now. I don't know. Jack's tennis elbow. This is the last page I'll read here. Another example of how trapped emotions can cause physical pain came from a patient of mine named Jack. He was 42 years old when he came to me for treatment of his excruciating tennis elbow, which had been suffering for months. The discomfort in his right forearm had become so great that he could no longer even turn the key to start his car without terrible pain. Wow. I began treating him with the traditional chiropractic approach of spinal and extremity adjustments and physical therapy. After working on him for about a week, didn't see much improvement. That surprised me. Tennis elbow is an ailment that is normally treated very successfully with chiropractic care. I was frustrated with Jack's lack of improvement. He probably got a trapped emotion of frustration. Don't tell Dr. Brad. This was in the early days of my work with trapped emotions. I hadn't yet thought to ask his subconscious if emotions had anything to do with his problem. I was just beginning to understand how powerful trapped emotions can be and how they can cause many different kinds of symptoms. I knew they could cause physical pain, but I also knew that tennis elbow was an inflammatory condition that I had treated successfully before. By the way, there is something in the body code called inflammation energy, and sometimes it can get stuck in the body. And sometimes when I work with people, there'll be multiple things. Like if you say, what's the underlying cause? One of the first things I do just for safety is I say, are there any trapped emotions that are causing, pain in this area? It's a very safe harbor way to go first. Just remove those first. And then I go into the body code and ask, is there anything else in the body code chart that can assist me with this area? And then it'll lead me. And sometimes I've seen an inflammation energy stuck there that was caused, and I'll say, what's the underlying cause of the inflammation energy? And then it goes to like a physical trauma they had. So the physical trauma that they had, energy was like 10 years ago. They got inflammation as well around the same time. And then once we release those, then their pain really goes down beyond just releasing trapped emotions. So where were we? I knew they could cause physical pain, but I also knew that tennis elbow was an inflammatory condition that I had treated successfully before. However, since I was having no results with the traditional approach, I decided to ask Jack's subconscious if trapped emotions were an underlying cause of his tennis elbow. I was a bit surprised when the body answered yes. All right, so we're going to leave it right here. And for those of you, I just wanted to thank everyone for the last video that I made that was in regards to Christmas. And I had about 13 emails of people that were like, I suffer with seasonal depression, or called sad, or they just have bad memories before. What's really interesting that I wanted to give you guys a recap on that is that a lot of people had trapped emotions when they were a kid that was in relation to Christmas. So childhood trapped emotions, I noticed, was a pretty strong theme in why you feel depression during Christmas. And so I thought that was interesting. And I did all email sessions, so it was great. I emailed them and said, hey, by the way, I worked on you. Oh, that's why I was receiving relief. Yeah, my neck pain doesn't hurt anymore. So I kept asking them for pain and that. And so if you're dealing with any type of pain at all this January, you're starting off 2018 and you have pain going on in your body, whether it's your neck or your shoulders, feel free to comment below on this YouTube channel and give me your you can send me an email. Actually, no, I think it's better just send me an email, codingalternative@gmail.com. And I'll work. I'm going to probably do some email sessions this month, and so I'll work on you. I'll work on one area of pain in your body, and then I'll send you the results to it. So that's something I'm going to do for January. I'm going to do a couple email sessions. So hopefully you enjoyed this emotion code reading, and we will be back on page 77 for the next one. And I think we're going to finish it to end it at part 2. So I'll see you guys next time. As I always end at the end of our video, I always say that the world has this notion that I'll take care of you if you take care of me. But if we take care of ourselves, then we can. If we take care of ourselves, then we can take care of others. And as we take care of ourselves, then we can change our home, we can change our country, we can change the world. So this is Emmanuel, your emotion code practitioner, and I will see you guys next time. Take care. Bye-bye.